I have been here about 10 years. I was faculty for about 8 years and then have been program director for almost 2 years. So welcome to our program, and we're excited to tell you about it. This first picture here is of our residents on their retreat last year. So unfortunately, because of COVID, retreat couldn't happen like it normally does, but hopefully next year they'll be able to go back to retreat. So our mission is really to train physicians for rural Kansas. And then we are located together with FQHC, a federally qualified community health center. And so our joint mission is to serve our community at the crossroads of compassionate healthcare and professional education. So we really feel like those two things are really important, taking care of patients and also educating physicians. And then we also educate a variety of other students, pharmacy, dental, nurse practitioner students here in the clinic as well. So we are located kind of in the middle of Kansas, where I-70 and I-35 meet. And these green dots on the map are where our graduates are practicing. And so we are very proud that about 94% of our graduates are in rural communities. Some of the strengths of our program: we are unopposed, and so we don't have any other residents here in Salina. So our residents really get, they don't have to compete with other residents to get procedures and opportunities to learn. We have great volunteer faculty. So I actually didn't train here in Salina. I came here as faculty, and I was blown away with just how awesome all of our specialists are at teaching. They know that our residents are going to rural areas in Kansas, and so they teach to that. And so whether it's at the bedside, whether it's in didactic time, over and over I've heard them say, well, this is what you would do in Salina, but if you were in St. Francis, Kansas, which is a really small town close to the Colorado border, this is what you would do, or this is what you do, and then you'd get them out of your ER as fast as you could. And so they just do a really great job of training our residents to know how to practice when they go out in rural areas. We have lots of opportunity to teach students here. So KU School of Medicine has a campus here in Salina that has 8 students every year. So the third year students do their family medicine clerkship with us. And then we have lots of sub-I students that come through here as well. As I mentioned earlier, we have dental students, nurse practitioner students, PA students, pharmacy students. So it's a learning environment here. Our residents, we'll hopefully talk about this in a minute, but I feel like our residents really have a voice. They elect a chief resident who serves as the representative to the faculty and to myself as program director. But we have a really approachable faculty. I feel I'm approachable, but residents can come with concerns and voice things that they feel like need to be changed. We do not require any in-house call. All of our call can be done from home. Now there are many times that you have to go in to see patients, but this really mimics rural practice. So you're going to be taking call from home most time in a rural area. And I think residents really learn how to balance being at home, knowing when to come in, knowing how to balance life, maybe a spouse or kids or dogs or whatever at home when you're on the phone talking to nurses or patients. And then we also have moonlighting opportunities. So starting in their second year, once they have their unrestricted license and have passed step 3 and taken ATLS, those are kind of our requirements, they have the opportunity to moonlight. And so a lot of our residents do this in rural areas. They get to see what a community is like and kind of get a feel what rural practice is like. They also get a chance to practice rural medicine, but still having some backup. So they, have faculty that they can call volunteer faculty and ask questions for. I'm going to talk a little bit about the clinic, and then I'm going to turn it over to one of our residents to do more talking. So Salina Family Healthcare Center is our clinic. We are a federally qualified community health center. And so for residents, that's really awesome because we get to do a lot more in-house than maybe another clinic would get to do. We are able to take care of patients without insurance, and the more that we can do within the 4 walls of our clinic, the cheaper it is for the patient. And so procedures, testing, x-ray, we have all that in-house. And so it is really awesome to see how those two fit together nicely so that we can take care of patients and residents get a great experience. We are a NCQA level 3 patient-centered medical home. And so we have a lot of quality initiatives. We measure a lot of quality items, so things like how good we are at taking care of diabetes and hypertension and getting people updated on cervical cancer screening, colon cancer screening, those things. So we measure those, follow them, and put in plans to improve those numbers. We have a team-based approach, so each resident is assigned a panel of patients, and then they're placed on a team. And so because residents are busy rotating through other things in the hospital and other specialties, residents are only part-time providers. So they're in clinic starting at a half day a week, and then as a third year, 4 to 5 half days a week. And so when they're not in clinic, the rest of their team knows their patients and can help take care of their patients as well. And then we have a lot of ancillary services in our clinic. We have an in-house pharmacy, we have dental, we have behavioral health services. We actually integrate behavioral health services into our clinic. So we have a behaviorist on call at all times that can see patients while they're in clinic seeing residents, which is really awesome. And then we have care coordination available. So sometimes patients aren't meeting their health goals because they can't afford their medications or because they have really poor housing or they don't have enough food to eat. And so our care coordinators can help with some of those social needs and connect them to resources within the community. So I'm going to turn it over to Dr. McNeil. He's one of our second year residents, and he's going to tell you a little bit about the hospital.
Hey everybody. So as a resident working in really a smaller community that houses a residency, when I first came up here, I was a little bit concerned that the hospital wouldn't have all the services I wanted when I was looking around as a fourth year medical student. When I got up here, I was really surprised at not only the size of our hospital, which has about 300 beds, and that's a little funny. About 110 of them are used for inpatient adults at any given time. And then we have a separate, just small hallway for peds and a rather large mother baby unit. So our hospital has a lot of services you might not expect a town of 50,000 people to have. We have 2 neurosurgeons, we have CT surgery. I think we have 7 general surgeons, and we do lots of vascular surgery. So basically services that we need in town, you can find at the hospital. There's not a ton of things that people have to leave town for. Working at the hospital, I think is fantastic. 1, they give us free food. 2, we have a lot of privileges to do. So we can do things. We can initiate and cancel stroke alerts. We can manage anybody in the ER. So we work in the ER every night of the week. There's a resident there seeing patients from our clinic. And kind of the cool thing, like Dr. Williams and Dr. Long hint at, is that we try to mimic real life circumstances for smaller town physicians. So if you can be at the hospital in 15 minutes, you don't have to be at the hospital. So say I'm on ER on a Saturday night and I have a 3-year-old and I get to eat dinner with her until I get called. You just grab your bag and go. So it's kind of an interesting way to do things. In a similar way, when we do OB, you're on call 24 hours a day for C-sections, and we have resident coverage around the clock all year for that. And one of the cool things is that you don't sit there all 24 hours of the day. You cover the floor in the daytime, and you go home and expect to be called and drop everything at a moment's notice and come to a crash section. So it kind of mimics real life, which one of the older residents once told me, if you don't like call as a resident, you won't want to be called as an attending, and then you'll know what kind of job to choose. I think they're right. So our curriculum is one of the big driving forces outside of the personality of our people that I think brought me here. Mostly, I thought I would not want to do OB. So we only require 2 months of OB. And then after I did 2 months of OB here, now I'm doing 3 months this year and at least 2 more next year. So I'm it's interesting how our curriculum will let you do what you want to do. So I thought I would do lots of sports med and lots of inpatient medicine. And instead I'm going to do a lot of OB. I think that's one of our real strengths is that, we know that everybody wants to be a different kind of doctor, and there's not just one way to practice family medicine. So starting in second year, there's getting to be some good elective time, especially for those who aren't doing extra OB, like I am. And then as a third year, there's as many as 5 months of elective time, which is great. You can use it to, go moonlight some. If you have a rotation that isn't crazy demanding, you can use it to get extra inpatient encounters. If you want to be a hospitalist, you can use it to do whatever is important to you. And I think that kind of variability is kind of unique, especially in a program the size of us with 15 total residents. So, Dr. Wright, I think.
Sorry, I apologize. I was looking at the questions in the chat and I got delinquent on my duties of forwarding the slides. So
that's okay.
Here we go.
I'm Kendra Wright. I'm one of the third-year residents. I'm also this year's chief resident. So I'm going to talk a little bit about Salina living. Like Dr. McNeil said, Salina is a town of about 50,000, which obviously is a lot smaller than Wichita or Kansas City. I grew up in a small town of less than 2,000, so Salina is still kind of the big city to me. We have a lot of fun things to do here in Salina. Everybody that's heard this talk before, Dr. Williams and Dr. McNeil, are getting tired of me saying the same thing over and over, but I feel like people always want to know, is there a Target? Yes, we have a Target. We have Chipotle, there's Chick-fil-A. So some of those things that I feel like applicants always ask about, we have some of those things here, which is awesome. Other top attractions in town, we have the Alley, which is a big bowling alley, like arcade type center. They have laser tag. They have like a bar and grill there as well. We have the historic Stiefel Theater, which is located downtown in Salina. There are musical events, comedy events, things like that that happen there. It's got some awesome architecture too, and is definitely worth checking out. Tony's Pizza Event Center is also here in town. Used to be called the Salina Bicentennial Center. That is kind of our larger event venue. So there are pre-COVID era, there were a lot of like larger musical events that happened there. It's kind of our big event venue. Smoky Hill River Festival happens every June. It's kind of the town festival, or like the town celebration for Salina. So they always have a lot of food vendors there, and like local artisan crafts and live music and like activities for the kids and stuff like that. It's really fun and always has a really good turnout every year. Rolling Hills Zoo is located just outside of town, and is actually a pretty nice zoo with lots of stuff to see, and is awesome whether or not you have kids. Regardless, it's still pretty cool. Kenwood Cove Aquatic Park is also here in town, a large water park. Well, I say large, it's not like, Oceans of Fun or anything like that, but it does have a few big water slides, a lazy river and things like that, and is lots of fun in the summertime when it's warm. Salina also has a YMCA. There's the Salina Community Theater, which has a lot of local like musicals and plays and things like that there, which is really cool. And then there's also an indoor trampoline park, which is always popular with the kids. So lots of things to do in Salina when you're not in the clinic or at the hospital.
Thanks, Dr. Wright. So I'm putting up our contact info. Unfortunately, Dr. Long had a family event, so she wasn't able to stay for this presentation. She's one of our faculty. So feel free to email any of us if you have questions that come up, and then I'm going to address some of the questions in the chat. So the first one is, what percentage of the patient population is Spanish speaking? And so I don't know for sure. I think it's like 25 to 30% that has Spanish as their first language. So I speak Spanish and I use it at least weekly. So I also don't see, in my role as program director, I have a lot of administrative things, and so I don't see patients as much. So I would say you could probably use it daily, honestly, depending on the patients that you're seeing. We do have an in-house interpreter for Spanish, and then we utilize iPads. I can't remember the program, but an interpretive service through the iPad for languages other than Spanish, or our Spanish interpreter is not here.
I definitely use our interpreter at least once per 10 patients, but usually at least once per session.
Yeah. The next question is, does the program utilize telemedicine as part of the curriculum and treatment? So yes, but just recently because of COVID. So we really hadn't utilized telemedicine before then. We went with, I can't even think, UpDocs was the program that we used initially. And then actually now we use Athena EMR, which nobody loves their EMR, but Athena is one of the better ones I've used. And it, Cure for Me, Cure with a Q, has a program that connects with Athena so that it's more integrated into the medical record to do telemedicine. And so we have continued to offer telemedicine to our patients, and I think it's been a really good thing. We have some patients that are pretty high risk that still don't want to come into the clinic because of COVID. And then we do pull from kind of surrounding communities. So I think we will continue to use it for patients that aren't able to travel or other instances where it's beneficial. So I wouldn't say that we're like experts at using it yet, but we definitely have started. The next question is, does the program view the whole application and the selection process, or use a screening tool like year of graduation or scores to select applicants for interviews? So I would say that we look at the whole application. Probably our main criteria is really a connection to Kansas. So knowing that we train physicians for rural Kansas, we know that if people either are from Kansas, that we train physicians to practice in rural Kansas, that if people are from Kansas or have some connection to Kansas, they're more likely to stay. And so that is something that we look for when selecting applicants to interview and through the interview process. But we don't have any hard cutoffs like year of graduation or specific scores that we screen for.
Okay.
Feel free, I'm gonna stop sharing just because I can see people better when I am not sharing. So feel free to